Is it okay for me to get started, Nick?
Yeah, I would crack on and people can join.
Thank you everyone for joining. So I'm going to be talking about a piece of work that we did called the Emerging Evidence Series today, which basically looks at the early evidence that we saw around the impact of coronavirus on children and young people's mental health. So firstly, I just want to thank a few people, Jess Dayton, whose slides I finished several of, and the entire Emerging Evidence team. This was definitely a team effort from several people who are in the CORC Forum today. Just to provide a little bit of background, so very early on in the pandemic, a lot of professionals, both in mental health and outside of the field, were really concerned about what the potential impact was going to be on children and young people's mental health. And this led to a lot of speculation as to what would be the outcomes, basically. And so within the last kind of year or so, actually, there was a lot of really rapid evidence starting to come out that was trying to extrapolate, you know, what are the impacts going to be based on previous learning, and then what do we know so far. So I'm going to talk a little bit about what that emerging picture actually looked like, and what we learned. So just to kind of briefly go back, for those of you who were in the earlier sessions and heard, I think it was Kate speaking when she mentioned this, mental health difficulties are on the rise. So in 2012, our data was telling us that 1 in 10 young people had a mental health difficulty. In 2018, this rose to 1 in 8, with only 1 in 4 having contact with a mental health specialist, and just under half actually willing to speak to a teacher for support. And then within the period of COVID in the 2020 sample, that number has increased to 1 in 6. So we're curious about, you know, what's changed over the last few years, but particularly over the course of the pandemic. And one of the things that we've also seen, just to put this in a bit of context for you, is that actually over the last decade, there's been a decline in children and young people's happiness. So these are just some shots of the Emerging Evidence Series, which you may have read, and if not, I encourage you to go away and have a look at those. And again, this was a massive team effort, where we tried to summarize a few key points basically around what was coming out of the evidence. So what we were interested in was, what are the key mental health challenges for children and young people during the coronavirus pandemic? What are the key mental health challenges for disproportionately affected groups? And what might help children and young people to manage these challenges? So I just want to, as a disclaimer, say that what we didn't do in this was look at the kind of quality and the robustness of each of the pieces of the research that came out. This was very much a very rapid review process in which we quickly tried to assess what was coming out and what were the key messages along the lines of those 3 questions. And so what we very quickly were seeing was that the children and young people that everybody was sampling were showing increases in worry, low mood, grief, hopelessness, but also that there is an increase in mental health problems. So I'm going to talk about this in a bit more detail and break it down. So the left side of the diagram has kind of the lower level mental health difficulty. So stress and worry, lower well-being, grief, loneliness. And then the right side is the more clinical levels of difficulties, which are related, depression, anxiety, PTSD, which I think Miranda had mentioned earlier on as being a big problem throughout the pandemic, particularly in young people who have been infected themselves, and also self-harm. So just to give you a little bit of a sense of what this looked like in the literature. So there was 40 to 50% of young people reporting that they felt significantly more anxious during the pandemic than they did before the pandemic, and they were particularly worried about their families and parents. And that's just from one study. Another study, but this was in the US, reported that 80% of young people felt that they had been impacted negatively by the pandemic, with 1 in 5 saying that their mental health had gotten worse over the course of the pandemic. So we also looked at what was contributing to these challenges. And so there were some general things that were contributing. So things like media reporting, the uncertainty, the sense of threat. And what we were seeing is that young people who are really consuming too much media were feeling that the threat was much worse than it actually was. And that's not surprising. That's a similar thing for us as adults as well, consuming too much media. In addition, there is challenges associated with actually being exposed to the virus, so fears around contracting it, anybody who's in ICU and experiencing invasive procedures as a result of infection, and then lots of young people have experienced the loss of a family member and quite often a parent. And so, as Miranda had highlighted earlier, we have seen a disproportionate number of young people who have displayed symptoms of PTSD following having the virus themselves. So another thing that's contributed to mental health challenges during this time for young people have been lockdown measures. So whilst completely necessary for containment purposes, they also meant that there was a removal of usual structures and routines. Young people are having far less social contact. They're having financial difficulties, and so were their families. There was many missed opportunities and unplanned endings. Equally, though, parents had increased pressures, which influenced their ability to parent. There's a lot of changes to family dynamics during this time period, with people stuck at home in the same place. And for many young people, they had increased caring responsibilities. And just again, to give you a little bit of a sense of what some young people are saying, a lot of young people are really concerned about missed opportunities. So things like milestones and exams and graduations and just key opportunities that they didn't get to take part in during this time. But that being said, it's not all doom and gloom. There has been some positive results coming out of the pandemic. So some young people have actually been thriving and have reported that they've taken up new hobbies, they've maintained or rebuilt social networks, they've still been doing different activities, but have had to adapt how they're doing them. And obviously learning has moved online for lots of young people, which for many has been a positive, particularly some young people with particular types of anxiety. Young people have also reported that they've really found a lot of support in family and friends. And for many young people, actually, the lack of being in school and closures meant that there was less academic pressure placed on them. And so some young people, particularly adolescents, have actually shown lower levels of anxiety over the course of this period. That being said, not all young people have been impacted the same. We're not experiencing the pandemic on a level playing ground. So there are some young people who are much more severely impacted by the pandemic in terms of their mental health. So the groups that I've listed here are some of those groups who have shown to be disproportionately affected. So children and young people with existing mental health problems, those with educational needs or disabilities, particularly neurodevelopmental disorders, children and young people of color, those experiencing poverty or with social care needs, girls and young women, and also LGBTQ+ groups. I'm going to talk a little bit about some of these groups in a bit more detail, just to give you a sense of why they've been differentially impacted. So for those with pre-existing mental health problems, they've had very limited scope for normal routines. There's often been reduced access to the support that maybe they had in place before or needed. The increased level of uncertainty for those, particularly with young people who have anxiety, has been problematic. And there's much less informal support. So if you think of, a young person going to a teacher or peers within the school setting, when they're stuck at home all day, they didn't have that same support. And then when we were in the process of schools opening back up, a lot of young people were extremely concerned and worried about going back to school and making that transition. So those with special education needs have also been really impacted. For this group, it's been largely the changes to the routines that were in place that were very crucial to their mental health and well-being. So they've had much more challenge having educational support. So they might have been getting extra support in schools, but doing that remotely might have been a challenge for them. And they might have had less capability for tailored learning given the remote delivery. And it was this, things have moved on a bit, but it was a big learning curve for schools, and there was a lot of adaptation that had to happen very early on. In addition, although a lot of therapies moved online, for some young people, they had limited access to these therapies. So for example, speech therapy or occupational therapy or even behavioral therapy. In addition, for young people with special education needs, is put increasing pressure on parents who may have been either trying to work from home or having to commute if they were a key worker, and then having to find that additional support for their child at home. Similarly, young people with disabilities or other long-term health conditions were disproportionately affected. So that is partially due to shielding and isolation. So they may have not been able to go out as much as some other young people, and that there's been limited access to carers and any additional support. All of that was interrupted very early on in the pandemic and pretty much for the first year or so. And again, additional pressures placed on parents. So there's a lot of reasons why these groups are more impacted, and they're not particularly surprising. Again, along a similar vein, young people who have existing social care needs. So if they're from a vulnerable family or have experienced domestic violence, all of these things were fueled and exacerbated by the pandemic. So increased stress and economic stress, potentially drug and alcohol abuse, and young people being confined in their house with a potentially abusive person meant that they also couldn't get help or support and were really stuck. So I think the other thing that's really come out of this is that schools did play a major role in safeguarding. So where schools would have picked up on a lot of these cases and young people with social care needs, that's very hard to do remotely when you're seeing somebody on a screen, a few times a week, if that. And so for these young people, they really were kind of trapped in a system that they couldn't really escape. And what we've seen and what the data shows is that there was an increased use of helplines over the course of lockdowns and the pandemic in general. And so again, young people with social care needs have been really impacted. So there's obvious health and health implications and physical distancing implications for many people, and those in residential care might have not been able to take some of the precautions that they would have liked to, just based on their physical environment, and often then had very limited contact with family. So for example, some people in care weren't allowed to see their families at all during lockdowns. It wasn't allowed, and so they were really isolated during this time. Another group that has been really disproportionately impacted is those from minoritized ethnic groups. So I think what everybody has recognized is over the course of the pandemic, it really has amplified existing inequalities. So things like institutional racism, discrimination, and health and economic inequalities. So for example, people from Black and Asian ethnic groups have higher infection rates and mortality rates from the pandemic. And so it's not surprising that these young people are, experiencing more loss, but also more worried about potentially experiencing loss and then the health of their families. And these groups were also more likely to experience loss of income over the course of the pandemic, and have limited access to healthcare and have key worker jobs. So just to carry on from that, the pandemic has increased the likelihood of poor mental health outcomes for these groups of young people, but they also have poor regular health outcomes, physical health, not regular physical health outcomes. And all of those additional challenges help contribute to why they have had increased mental health problems. Additionally, it's much harder for people from minority ethnic groups to actually access support. I think this is the last group that I'll talk about. So if you can bear with me a little bit longer. So children and young people living in poverty, again, similar issues with lack of social distancing, parents likely to be in key worker roles, financial pressures. And one of the key things that had also been a problem is gaps in education. So for children whose families, had, extra laptops and plenty of space, they were much more able to access education. For those who didn't, they might have had to share and only had it at certain times of the day, which may not have coincided with their coursework. So the education gap has also increased. And then girls and young women are also showing more problems, higher PTSD and OCD, and anxiety in general, as well as a decrease in life satisfaction compared to boys. So just to give you a break from all that, because it's a lot to take on. We don't really know what the long-term picture is going to be yet. There's been a lot of speculation based on previous pandemics and disasters, but we do know that there's been an increase in social inequalities, and there have been gaps in education, and that it's something we need to really keep an eye on, being the mental health of children and young people at this time. But again, it's not all doom and gloom. So research has also identified a number of things that might help. So things like keeping up routines, maintaining social contact, not consuming too much media, having open conversations. For those working with children and young people, look for early warning signs, and really encourage self-care amongst young people. I can, at the end of this as well, there's a number of resources that the Centre has put together, which I can point you in the direction to. But it's also really important to note that, some responses to the situation are normal, so some level of worry and distress and loneliness is completely normal given the circumstances. It's been a novel experience for everyone. But for those who are having more serious mental health problems, it's really important to be aware of the early warning signs when problems may be escalating, and to be aware what support might be available. So if you work with young people, know what is on offer in your area for that young person, and that there are flexible support solutions provided. So many services have moved online. For some young people, that's worked really well, and others have had to come up with more creative options. So I don't know really whether we've got kind of people from schools or practitioners or what the breakdown of the group is, but for schools in particular, the evidence is showing that if we put education at the heart of the return, if we put mental health at the heart of the return to education, which what we've now since seen is many schools have done that, and have kind of checked in with young people about what's going on to get kind of a temperature check of well-being, and that also we're seeing a number of initiatives to upskill school staff to recognize those who might be struggling, but also increase capacity for therapeutic support, but also just being really aware of those disproportionate groups who could be more impacted if you're working with them. There's a number of things mental health support services can do as well. We have seen this increase in demand, but that doesn't mean that there's an actual increase in supply. So any adaptation of services for kind of safe delivery is really important at this time. And I think one of the other things that's really come out of the evidence is the need for communication and joint working between all of the sectors that are working with children and young people. And what we're also increasingly seeing is that young people's voice is starting to become at the center of this conversation, which is really crucial for going forward. So that is it for me in a nutshell. I know that it's sort of a lot of information to take in, but I'm happy to answer any questions if there are any.
There was a question that came in the chat earlier, Melissa, from Barry.
Right now, so.
You want to ask your question, Barry?
Hi, yeah, sorry, I'm juggling a phone and a laptop here. No, I was just find it interesting that you said child and young people's mental health was on the decline the last decade. And I just was wondering, do the numbers suggest that COVID has actually accelerated that decline, or could it have been sort of naturally going that way anyway?
It does seem to be that it's really exponentially increased the rate of poor mental health in children and young people. I think there's still some research that's starting to unpick this a little bit, but it does suggest that, particularly for the groups that I've mentioned, the pandemic has widened gaps and has really exacerbated existing social discrepancies and institutional racism, and there's a lot that has been on the rise that is associated with the increase in mental health problems. You know, it's hard to compare much before that, because before the kind of, I guess we've got more evidence within the last decade, but before that there wasn't much more evidence. But it does seem to be that you know, the pandemic has increased that.
Yeah.
And I think, well, just to add in there, and I think some of the other reason for that is these lack of experiences that young people are having. So these key developmental experiences and socialization, like the younger age groups, the kind of pre-primary, really require a lot of socialization for learning, that equally you see that kind of later on in the teenage years as well.
Yeah. And just one follow-up, we had a look now back a year ago, we'd had a look at see if there was any specific measures for COVID. Has there been anything developed over the last while that's very COVID specific? Because we have tried to pick up any young person that's had, you know, COVID specific anxiety, but we have nothing. You know, if somebody is identified as that, because I do imagine you'll get somebody that may not have had much anxiety, but they're coming in specifically because of COVID. Now I just think that's what's going to happen, and I would love to be able to pick, you know, for to be able to have a specific outcome measure for it. Is there anything there yet?
So yes, I can't recall which issue we covered that in, but there were a few studies that did develop COVID specific measures. Now, you know, they're not widely validated, or, you know, nobody's looked at the psychometric properties of them, but lots of different studies have started to put measures in place asking about COVID specific anxiety, and some of the bigger studies, I think CoSpace and CoSpice may have also specifically asked about COVID related anxiety, but most studies are now including that. There was quite a few.
No, that's great. Thank you. It's a really important piece of work, like, because it's going to be massive over the last, probably 50 years. We'll still be dealing with it, I would imagine.
Yeah.
Thank you.
Yeah, thanks.
Peter's got his hand up, Melissa.
Hi, yes, lovely talk. Thank you. I must admit, sort of going into a COVID-related talk, part of my heart goes, this is really hard. This is really hard. But I made myself do it. And this is a bit of a moan and a recommendation as well. So in terms of the strength of the data relating content of the news to mental health outcomes, particularly on kids, children, young people, I know personally I had to turn off the news at lunch. Just I can't listen to it, particularly in the first wave. But what about the bigger data? What's the bigger data tie those two things together? So my just experience of it was on the media. It sort of swung. What was being presented on the main news was COVID's progress, and it was really unrelenting bad news, bad news, bad news. As the curves were growing down, the shift went to the impact on the economy of lockdown, which is bad news to counteract the good news of the reduction in COVID spread, etc. And just to comment on the media, really, is there something that to help regulate the media's balance of positive versus negative news in times of crisis, particularly? I did pick up they were beginning to put at the end of each news here's a good news story. A whole bunch of people stayed in the care home over Christmas, you know, leaving their families to look after the people they were looking at. It was a beautiful, it made it really quite tearful actually seeing that. But is there a role for feeding some of this evidence? Well, is there strong evidence linking those, and can we feed it to the media to say, look what, you know, not being too blaming, but can we have a balanced approach to media, particularly in times of crisis? Sorry, it's a bit of a long-winded.
No, I think it's an interesting point. Media is not my field at all, so I can't really comment on that and whether there's anything in place. I mean, my understanding is, you know, the media has a responsibility to present what's out there, but I think as a researcher and as scientists, we have the responsibility to present a balanced picture. And so I think one of the things that we were careful with, particularly in the emerging evidence series, is to say, you know, these particular studies showed this, but that doesn't mean that every single study will show that, or that every single young person is actually having a hard time, because what we've seen is there are ones who are not doing as poorly and who are thriving. But then I think it's tricky, because when you're in a public health crisis like this, it is important for people to know where the challenges lie at the same time, and for people to be informed. And so I think, not that anybody really needs to be told by the news that, you know, things are hard on their child or things are hard on them. But I think, you know, having good data and reliable studies and kind of a synthesis of that information is really important for the general public. And that's partially why we did this series, is because there was a lot coming out so early on, and it was really difficult to make heads or tails of that if that's not something you do. And we felt, rather than contributing to kind of the onslaught of information coming out, that actually what we do is try and synthesize what was there and present it in a consumable way for people should they want that information. Yeah, I don't know. I'm not sure I really answered your
It's
question.
an ongoing debate. I think it's I mean, it's a quite a position of power, I think, from, you know, your organization to be able to, and can you use that in a way to shape society in a positive way in crisis, really? I think it's.
And I think the other thing that was really important to us was not just to point out, you know, what's going wrong in this situation. It's what to do about this, and to have it to be a call to action, because the reality is mental health is everybody's